As government prepares for national health insurance, public clinics across the country are being upgraded to meet the additional standards.
Now, yesterday, the health team headed to Eleuthera, where facilities there are set for a major overhaul, as Cleopatra Murphy tells us.
The Spanish Wells Community Clinic has fallen into a state of disrepair with its leaking ceiling, malfunctioning air conditioning system, and the morgue that is non-operational. But Minister for Grand Bahama, the Honorable Dr. Michael Darville, says the problems at that clinic and others in North Eleuthera will be addressed. Darville and a team of health officials conducted assessments at that clinic, along with the Bluff Community Clinic, Lower Bogue Community Clinic, and the Hatchet Bay Community Clinic Tuesday, and Darville says work will begin within 2 weeks.
We've done an extensive amount of work through the Department of Public Health, laying the foundation, and today we will tweak what we have done, and the architect will go to work to finish the necessary scope of works and to determine the phase approach so we can award the contracts and begin to improve the physical infrastructure as well as the quality of services we provide on the Family Islands through universal primary health care.
As for the Bluff Clinic, Darville says it has a termite problem, and officials have identified a temporary space as they consider demolishing or reconstructing the clinic.
We have found that location, and work has already been done to initiate a scope of works that will go to our quantity surveyor, and once it's completed, we will issue a contract.
Managing Director of the Public Hospitals Authority, Herbert Brown, says officials are dedicated to ensuring facilities meet the standard for national health insurance. He says outside of physical infrastructure, they will address other challenges immediately.
Today was a good opportunity for me as the Managing Director of the PHA to look at those issues and to ensure that supplies, whether that is medical and surgical or pharmaceuticals, are always available in our clinics so that the Bahamian people who might need care will have those supplies.
Administrator for the Department of Public Health Services, Charlene Bain, says the trip is allowing officials to examine manpower needs and how they can extend operational hours.
We heard from Spanish Wells. They are adamant about the need for the replacement of their physician, and we will do that. We also will augment the nursing services in Spanish Wells. In the next week, another nurse will join the team of 2 nurses.
Spanish Wells resident Jerry Pinder says the state of disrepair to the community clinic is troubling, and while happy seeing something done, he says the blame must be shared between various officials.
Like I say, it's everybody's fault. I don't think Peter should be blaming Paul. Everybody needs to take responsibility for the state of the clinic.
Principal of Architects Associates Victor Cartwright says the clinics have different needs.
Some are in more dire straits than others, but like Spanish Wells and Lower Bogue, we are going to be doing some immediate repairs and expansion to those 2 clinics. Bluff is a little bit more work, so we're going to also be looking at that long term.
A cost for the upgrades was not supplied, but Darville says once completed, the clinics such as the one in Spanish Wells will also benefit from the single medical record platform that will allow medical professionals to access patient information from anywhere. Cleopatra Murphy, ZNS Network News.